Nearly 250,000 teens in this country had plastic surgery in 2012, according to the American Society of Plastic Surgeons. But it's important for teens and parents considering any procedures to consider the risks, both physical and emotional, before moving forward. Here to run through what you need to know is Dr. Chaffoo from Scripps. Thank you for joining us.
Thanks, Kathleen.
So what is the motivation typically behind teens wanting plastic surgery? Because all of us remember being so insecure at that age.
And that's a great point, Kathleen. Really, you want to make sure when we see patients in our practice that they're having surgery for themselves. They're not doing it because their parents have pressured them, because they're being cyberbullied, because they want to fit in, or they want to attract a boyfriend or a girlfriend.
So what are the most common procedures that teens are asking for and parents are allowing to be done?
I'd say, Kathleen, the most common procedure is a rhinoplasty, or the late-term nose job being a common type of procedure, chin augmentation associated with rhinoplasty, and then various breast types of procedures, breast procedures that are done more for medical or functional concerns, like particularly enlarged breast reduction, or to improve congenital deformities of the breast.
Are there any particular risks on performing these procedures on a younger person because their body is still developing?
And that's a very important point. So you really want to make sure before you consider any elective procedure that growth has completed in that area. You're right, otherwise you can interfere with growth. And you want to really make sure that the teen is emotionally mature at the point where they can make a decision and understand they're doing something really for themselves. They have a problem that they've been concerned about for years. Typically in our practice we'll see somebody that's not liked their nose for many years or are very unhappy with it, not something that they do on a whim.
So in terms of support then, what is the parents' role in all of this? How attentive should they be, before and after surgery?
Well, you're right. Support is everything. Whether it's a teen or certainly whether it's an adult, the support system is essential. We really want to make sure that it's the teenager that is interested in doing the procedure, that actually initiated the consultation, that isn't doing it for a parent. And then if we feel as plastic surgeons that there are good indications for the procedure, they're psychologically and physically ready for the procedure, that there's a good communication and good connection between the parent and the child.
So how do we choose the right plastic surgeon for someone of that age, and what are some of the questions that both the teen and the parent should be asking that doctor?
Right, so the big thing is you want to make sure that your surgeon is certified by the American Board of Plastic Surgery. They're a member of the American Society of Plastic Surgeons. They have privileges to do that procedure not only in an outpatient center, but also in a hospital should there be any complications. You want to feel comfortable with the surgeon. You want to feel like that person's listening to your concerns. You want to make sure that you're on the same page. And we do some computer imaging oftentimes in the practice, which helps us to communicate, make sure that we're both reading off the same page. The patient's concerns are also our concerns.
Well, those statistics showed that some people as young as 13 years old were going under the knife. What are your recommendations in your practice in terms of how young is too young?
So that's young, I would say, for most of the procedures that we do in plastic surgery, unless, for example, it's an ear pinning procedure, which is a congenital deformity. About 90% of ear growth occurs by the age of 6, so oftentimes that procedure is done when they first start school. But you're right. I mean, certainly I think 13 is a very young age to consider any kind of an elective procedure, and it's something that really needs really good communication between the parents and that child before they come in for a consultation.
All right. Well, thank you, Dr. Chaffoo, for addressing this trend from Scripps. We sure appreciate it.
All right, ahead here at 4, most people downtown know that finding parking can certainly